professors and colleagues. It's very nice time to share with you our experience in diabetic foot wound principles. Here is Dr. Mohammed Magdi. I'm a wound care specialist. Let's start. What's the definition of wound debridement? Wound debridement is an important component of wound bed preparation. It means removal of necrotic exudate and bacterial tissues and metabolic wastes to improve and facilitate wound healing. Why we do debridement? 3 points. First is to reduce and remove dead and necrotic tissue. Why? Because this is an pro-inflammatory stimulus and can be a culture medium for bacterial growth. Second point is to reduce biological burden of the wound, to control critical colonization, local infection on the wound surface, and to decrease the likelihood of deep and surrounding tissue infection. Third point is to visualize the sides and base of the wound more accurately. Determine where is viable tissue is present. So for wound healing to heal optimally, we have first have a microenvironment relatively free from non-viable tissue. Second way is to improve oxygenation. Oxygen is primary requirement for the energy-dependent metabolic process. Third point is the production of free radicals, which is crucial for wound healing, facilitate the process of killing bacteria and promote proliferation of both fibroblasts and epithelial cells. In hypoxic conditions, it competes with the healing of tissue and nutrients and produce an inflammatory environment with endotoxin and exotoxins that damage a newly generated cells. So what's necrotic tissue? Necrotic tissue impairs wound healing as its physical barrier to granulation tissue, wound contraction, and reepithelialization. And also herpes bacteria may be a medium culture for bacteria and increase wound infection and impaired wound healing. The more necrotic tissue in the wound, the more the tissue damage and takes the wound a long time to close. Necrotic tissue, when the tissue die, it changes in 3 points: color, consistency, and adherence. What's the color coding for wound bed? Any wound bed has a color. It started from black, gray, yellow, pink, red. So in black tissue, it's a necrotic gangrene tissue. Then the range of gray, white color. Then yellow color is a sloughy tissue. Then range from red is a granulating tissue, which we are searching for pink color, which is the reepithelialization tissue. So what's going in necrotic tissue? Necrotic has different colors, ranging from white, gray, tan, yellow, and brown, black. In consistency, there are different consistency of necrotic tissues like mucinous and soft stringy, which is mucinous tissue, hard tissue, then soft soggy like moisturized, then hard caps like eschars. Necrotic tissue adherence of the debris to wound bed and ease with which the two are separated. Necrotic tissue tend to be more adherent. This serve as the damage is and less moist the wound is. So the characteristics of the necrotic tissue is with color white, gray, yellow fibrinous, yellow tan, slough, and black eschars. In consistency, mucinous, soft stringy, and soft soggy, and hard. In adherence, clumps, loose attached to the base only, and firmly attached to the base and the edges. So in white gray, it may be mucinous and easy to remove. In yellow fibrinous, it may be stringy and loosely attached. In yellow tan, it's soft soggy and adherent to the base only. In black, It's hard and firm to the base and edges. This type of necrotic tissue, the type of wound bed, it may be slough, may be fibrin, may be eschar, may be gangrenous or hyperkeratotic. So what are types of wound debridement that we need? It may be mechanical debridement, enzymatic debridement, sharp debridement, autolytic, and biological debridement. What is mechanical debridement? Mechanical debridement is the use of outside force to remove dead tissue, like wet to dry gauze, wound irrigation. Why we do wet to dry gauze? These are commonly used debridement technique, and it has multiple advantages and disadvantages. Let's see. In advantages, it's familiar to healthcare providers, just need wound irrigation, and it may soften the necrotic depth. But the disadvantage is non-selective and painful technique, costly, and may cause skin and peri-wound area maceration and release some airborne organisms. So let's search for another technique. It's enzymatic debridement. Enzymatic debridement is application of highly concentrated, commercially prepared proteolytic enzymes like collagenase enzyme to the surface of the necrotic tissue in the expectation that it will aggressively degrade necrosis by digestion of devitalized tissues. So what are the advantages and disadvantages? The first is this is highly selective and very effective in combination with other debridement techniques like sharp debridement. The disadvantage is that enzymatic debridement may prolong more than necessary and increase cost. It may take 30 days to achieve completely clean wound bed, and it changes the wound pH, may cause an irritation, and inactivated by other heavy metals like zinc and silver. There is a risk of maceration and the wound area, skin maceration and infection, and requires 1 to 3 times per day of dressing. So another technique is sharp debridement. Use a scalpel scissor. As a surgeon, you can remove the whole necrotic tissue, viable and non-viable, in 1 minute. It's the most rapid and effective and may convert a chronic to an acute wound, requires analgesics. It indicates of removal of thick adherent, a large amount of non-viable tissues, require a certain level of experience, and there is a risk of bleeding. So there is a idiom called conservative sharp debridement. There is a use of combination of enzymatic, mechanical, and autolytic debridement to speed removal of non-viable necrotic tissue. So the combination of sharp plus enzymatic, mechanical, or autolytic debridement. So what's autolytic debridement? Autolytic debridement is the use of body-owned mechanical enzymes to remove non-viable tissue. The collection of fluid at the wound site promotes rehydration of the tissue and allows enzymes within the wound to digest necrotic tissue. May be accomplished by the use of any moisture retentive like hydrocolloid, hydrogels, hypertonic dressing, and gels. So the advantage is painless in patient with a painful wounds, effective, selective, low cost, and maybe a combination with another techniques. But it's slow and need some education. Maybe cause skin maceration. Actually, autolytic debridement could be used in a dry wound, but enzymatic need a moist wound. There is a biological process, the use of larvae. Larvae, we can use a maggot larva, debridement therapy used for a medical grade green bottle fly larva, and application with a disinfectant maggot to the wound to remove non-viable tissues. We can leave the maggot for 2 to 3 days, and they secrete proteolytic enzymes, break down the necrotic tissue, and then ingest the liquefied tissue. The secretion also have antimicrobial properties, promote growth of human fibroblasts, and improve granulation tissue formation. The advantage is reduce bacterial burden and the growth of stimulating effective. The disadvantage is the limited number of studies, availability of sterile medical grade maggot, lack of policies, and some psychological issues. So there are three zones of necrosis. Zone of coagulation containing maximum damage area. Zone of stasis containing thrombosed vessel, peri-wound area. And zone of hyperemia containing engorged vessels. So when choosing a debridement method, no one method for debridement has been proven optimal for diabetic foot wounds. So we have to ask ourselves, how much time do you have to debride? What are the wound characteristics? How selective a method is needed? What methods are permitted? What is the care setting? How much debridement is enough? So you have to draw the plan to, to determine the best option or combination plan we can use for tissue debridement in wound and diabetic foot. So that's all. Thank you.